Jan, and thank you everyone for sticking out to the end of the day. I appreciate the opportunity to present on behalf of Animal Health Canada. There's other people in the room, Mickey in the back, who are also very knowledgeable about this organization. So I'm the messenger, but certainly we can have a conversation. So the ability, oh, sorry. Okay. What is that stuff there? All right. The ability of a country to deal with and recover from unforeseen events determines, and in many cases, its resilience. I think this word resilience has become, it's common vernacular since COVID. It's a word that we weren't using before. But the Canadian livestock sector is recognizing that we need to be prepared and we need to be ready to respond, and most importantly, we need to recover from the foreign animal disease that we all know is not if, but when. And the recognition that the Canadian livestock sector has changed, it's modern, it's export-based, it's intensive, really made us recognize that the old system of having industry trust that government would take care of this was an outdated system, and we needed a new model. And that model was Animal Health Canada. So Animal Health Canada, I apologize. There we go. Okay. The purpose of Animal Health Canada was to establish a harmonized and integrated approach to the management of broad animal health and welfare program. So it is really meant to pull science, to pull industry, and to pull policy together, to work together in a very collaborative way where we have government and industry sitting side by side at the table as peers to really find win-win solutions to our animal health and welfare issues. I'm going to focus on the word animal health today, but we need to remember that Animal Health Canada also encompasses welfare and animal care. So the vision, which I think, Rory, you were very instrumental in, I apologize. Can you just go forward for me? I'm just going to do the little finger again and again. And one more. There we go. The vision, which I think you, Rory, were very instrumental in establishing, is for a sustainable agriculture and agri-food sector that is strengthened by an inclusive industry-government partnership. So it's this idea of this public wow, it's the end of the day. Public-private partnerships that we really can do a new way of solving our health and animal welfare problems. So there's 4 pillars within Animal Health Canada. The one we're going to talk about today primarily is emergency management. I mentioned Mickey, she's been very integral, her and the AHEM team in that pillar. But we also have a pillar focused on disease surveillance, a pillar focused on animal welfare, and a pillar focused on developing a resilience, governance, and operational model. That sounds boring as dirt, but it's actually been incredibly important, and it's getting that foundation right so that we can actually sit at the table and make some of these decisions with government that typically have been enshrined within their regulatory authority. So that's been quite important. So how is Animal Health Canada structured? Well, we have our priorities, and what they've done is they've got divisions. One of these divisions is the National Farm Animal Care Council. So that is the organization that holds and enshrines the codes of practice for animal care. They were a standalone division historically, and they've now been brought in under the Animal Health Canada umbrella. We also have a division called CAS, or the Canadian Animal Health Surveillance System, which is looking after networks of surveillance and people involved in surveillance. And really it's a network of networks to make sure that we're talking to each other. And we're just in the process of seeking funding to establish a new division, so a third one, which will be focused on emergency management. Underneath those divisions, then we do lots of project work, and that project work tends to work on a 5-year cycle, and so it's a little bit less consistent and less of a long-term vision, whereas we really do envision that those divisions will be long-term. So talking specifically about the Emergency Management Division, from 2016 to 2023, we have what was called the Animal Health Emergency Management Project. And they really endeavored to improve the emergency preparedness and response capabilities of stakeholders. And who they focused on national organizations, emergency response plans, provincial organizations, emergency response plans, and producer response plans. But they were not looking at disease-specific response, they were looking at emergency preparedness. Moving forward, we're looking at this division, which will ensure that the welfare of farm animals is protected during emergencies. So it will encompass disease outbreaks. It'll also encompass things like preparedness for natural disasters and other critical incidents. So it really is those 3 Ps that we talk about all the time. So under this project, or this division, the priorities will be information management, resource development, education and outreach, and the coordination of disease-related emergency management structures. Why do we need this? I think I'm preaching to the choir when I talk to this room. I mean, there's lots of words on this slide, but I think you hit it on the head. You know, in your career, when I look at the number of zoonotic diseases, transboundary diseases, emerging food safety diseases, emerging viral diseases like PB virus in hogs that we've never seen before, even coronavirus in humans, the COVID outbreak. We are living, as the globe becomes increasingly populated and our animal populations become increasingly crowded and raised in intense situations, we need to develop new ways of managing diseases. So moving forward, Animal Health Canada really does have a critical role in getting ahead of this. So our role is principally in the prevention and planning of diseases. We're not a response organization. So that if and when the foreign animal disease comes to Canada, that response piece remains with the CFIA, our federal authorities, and certain aspects with our provincial authorities. So Animal Health Canada is not a response organization. We are about preparedness, planning, and then the recovery piece. So I'm going to just speak to a couple of the pillars within this emergency management division of the projects. The African swine fever one has been ongoing for 5 years. It was spearheaded very much by our pork industry. We've got Jeff Clark in the room here today. He's been integrally involved. It was the test case, the pilot, shall we say. And they had unprecedented efforts between all levels of federal, provincial, territory, and industry to increase Canada's readiness. I can't even begin to estimate the number of working hours that have gone into what's known as the ASF EMB, or Emergency Management Board, but there are layers, pillars and layers and sub-working groups, and they have dug deep into the preparedness for African swine fever. Those of us in other sectors looked at that and said, wow, you guys have gone from being unprepared to, I mean, maybe we're not ready for tomorrow, but just an order of magnitude of preparedness change. We want that for our organization. So we've also started to then work on the highly pathogenic avian influenza outbreak. Again, Animal Health Canada was not involved in the response. Instead, what they've been doing is they've been doing that behind the scenes coordination, templates to support mutual aid agreements so that goods could move from one province to another when there were shortages. CO2 for euthanasia was one of the examples. They partnered with CFIA on the development and the delivery of an online avian influenza course for veterinarians to improve education and awareness out in the field. And they coordinated workshops to share information and, to your point, some of these lessons learned experiences. And so that's where Animal Health Canada has worked with avian influenza to date, and I think as we move forward, they will be building on many of the preparedness plans that we've seen in ASF. And so, of course, foot and mouth disease is the one that keeps us up at night, and we will be developing a similar emergency management board for FMD that we now have for ASF. And the beauty of having tackled ASF first is that's the hard disease, or that's the easy disease, right? It's a single species, it moves on trucks, it's much easier. So they've build the plans for the case that is manageable. We can copy and paste most of that and then build on it for the complexity of foot and mouth disease, where we're talking about multiple species and multiple ways of moving around the country as opposed to just pig spread. A couple of the things that Animal Health Canada has already accomplished with respect to foot and mouth disease is they were very integral in helping us get the government support for a Canadian foot and mouth vaccine bank, which we were pleased to have the federal funds announced last March. And they did that through, again, industry-government collaboration on a business plan, on how is a vaccine strategy going to be implemented, and moving forward, how is industry engaged in the deployment of that. So I just want to conclude my presentation. I talked about those different pillars. I didn't touch much on the welfare one, but I do want to give a shout out to CAS. The Canadian Animal Health Surveillance System is very unique. For those of you from the States, you live in a world where agriculture is so big, but in Canada, we're kind of all on a first name basis. It's a small sector and a small industry. And what CAS does is it just brings people together that are working in veterinary medicine, working in surveillance, working in diagnostics, working in practice, and just gets them talking on a regular basis about what are you seeing, what projects are going on, what are the gaps. And that network of surveillance, that first name basis surveillance work that CAS does, has just been instrumental in moving our surveillance forward, and also for bringing really fruitful ideas on how we can do surveillance differently, inexpensively and effectively moving forward. So that division, I didn't give it much attention today, but it's a fabulous division. So with that, you know, I really would like to hear your thoughts on whether we're going in the right direction, having been one of the leaders that got us started on this path. But I am very excited that Animal Health Canada will be a really interesting way for us to improve our preparedness, and ultimately, if this ever comes, our ability to respond and recover to disasters, including foreign animal diseases. Thank you.
Nice. Can I ask one question?
Yeah, you gotta ask Jan.
Oh, sorry. Is that foot and mouth disease thing the same as the versicular or whatever disease, or are they different?
So vesicular stomatitis is a completely different disease, but some of the lesions can manifest in a way that's similar to foot and mouth, so clinically they can be difficult to differentiate.
I see, but it's not as high on the list because it wasn't even listed as foot and mouth as the main ones they were looking at.
So Animal Health Canada is going to build 3 disease focuses, and they're really the top disease focus for each sector. So for the pork sector, African swine fever. For the beef sector, although it's all cloven hoofed animals, so anything with 2 toes, foot and mouth disease. And for the feathers, as we refer to them, it's avian influenza. So those will be the 3 priorities that we'll focus on initially.
Cool, thanks.
Yeah.
Thanks, Leigh.